patients with addictions. So can you talk a little bit about that and how did you get involved with that?
Yeah. So that was an awesome experience. And that's part of the reason why I gave with my words of wisdom, always be open to different avenues in your career, because up until then, I had only worked in private practice. And so after having twins and getting back to work after that, that kind of opened up a opportunity to work at this hospital. And it was very different in that a lot of patients in private practice, they, some people may be on some medications, and most of the patients are able to pay for things or services. Whereas at the hospital, a lot of the patients that I saw, they had mental health issues. They had binders of medical history information. So instead of, going through like a sheet or two of medication and, some conditions that they may have had in terms of their health, like there's pages on pages of stuff. So I have to look at all this stuff and medications and names of medications before even working on them. And so in addition to that, I had to also work with their psychiatrist and their physician on the unit when I was planning out their treatment for things that they needed. So that experience, it definitely allowed me to work with other doctors in terms of treating the patient holistically, not just focusing on their mouth, but how what I did could affect, other areas or how other areas in their body could affect the work that I was doing in their mouth. And then also, I was able to, with the addiction services patients, those patients, I didn't get to treat them comprehensively just because they're in the program for like 40 to 60 days. So it was turning on a different side of my brain on how to treat patients when I can't, have this whole treatment plan for them to do, and I'm not going to see them long enough, and prioritizing, what treatments needed to get done first. So it was a nice change in pace from what I was used to, but it was definitely a big learning experience. So